Hello, health-conscious individuals. Welcome to the Health Collective, your go-to resource for all things health and wellness. Our mission here is simple but powerful: to educate and empower you about your health. We bring you a plethora of topics ranging from nutrition and fitness, mental health, preventive care, to understanding common and uncommon health conditions. We believe in equipping you with evidence-based information, allowing you to make informed decisions about your health and well-being. We are your partners in health, committed to providing you with credible and up-to-date health information. We don't just scratch the surface. We dig deep, we research, and we present you with comprehensive insights into the world of health and wellness. Today we delve into a topic that affects many women worldwide: period cramps. It's a natural part of life, but it can also be a source of discomfort and even distress. Stick around for an enlightening discussion. To understand period cramps, we must first understand periods. What exactly happens during a menstrual cycle? Well, let's delve into that. A menstrual cycle is not just about having a period. It's a month-long symphony of coordinated hormonal events. The cycle typically lasts between 25 and 35 days, with the average being 28 days, just like the lunar cycle. The leading players in this symphony are hormones like estrogen and progesterone. They rise and fall at different stages of the cycle, triggering various changes in the body. For instance, estrogen levels rise during the first half of the cycle, preparing the body for ovulation. Once ovulation occurs, it's progesterone's turn to take center stage. It prepares the uterus for a potential pregnancy. Now let's talk about the uterus. This muscular organ has an important role to play. Every month, under the influence of these hormones, the lining of the uterus, known as the endometrium, thickens. This is in anticipation of a fertilized egg that could implant and develop into a fetus. If fertilization doesn't occur, progesterone levels drop. This hormonal shift signals the body that it's time to shed the thickened uterine lining, and so the menstrual period begins. This shedding process is what we refer to as having a period. It usually lasts between 3 to 7 days, with the body expelling the unused endometrial lining through the vagina. It's important to remember that periods are a normal part of reproductive health. They're a sign that the body is working as it should, preparing for potential reproduction each month. It's a natural and essential process that nearly half the world's population experiences. Now that we understand periods, let's explore why they sometimes come with pain. Period cramps, or dysmenorrhea, is a common symptom during menstruation, but why do they occur? Let's delve into the science behind period cramps. The main culprits behind period cramps are chemicals called prostaglandins. They're produced in the lining of the uterus, the endometrium, and play a crucial role in the menstrual cycle. During menstruation, the levels of prostaglandins increase, triggering contractions in the uterus. Now, these aren't the joyous kind of contractions that signal the arrival of a baby, but rather a different kind that can cause discomfort or even pain. So why do these contractions happen? Well, the uterus is a muscular organ, and like any muscle in the body, it contracts and relaxes. During menstruation, the contractions help the uterus shed its lining, which is a normal part of the menstrual cycle. However, when the contractions are too strong, they can press against nearby blood vessels, momentarily cutting off the supply of oxygen to the uterus. It's this lack of oxygen that causes the pain and discomfort we know as period cramps. Think of it like a cramp you might get in your leg after a long run. When you're exercising, your muscles need more oxygen, but if they don't get enough, they can cramp up. Similarly, when the uterus contracts during menstruation, it needs more oxygen. If it doesn't get enough, due to the contractions pressing on blood vessels, it can result in period cramps. It's also worth mentioning that higher levels of prostaglandins are associated with more severe menstrual cramps. Some women produce more prostaglandins than others, which can explain why period pain varies from woman to woman. So that's the biological process behind period cramps. But what can women do about them? Stay tuned as we explore the different ways to manage period cramps in the next segment. Remember, understanding our bodies is the first step towards managing our health. Although period cramps can be uncomfortable, there are many ways to manage them. Let's dive into some of the most common and effective tactics that individuals across the globe have found useful. Heat therapy is a tried and true method for many. Applying a heat source like a hot water bottle or a heating pad to the lower abdomen can help relax the muscles and alleviate cramps. This is similar to how you might use heat to soothe sore muscles after a workout. Over-the-counter medications are another frequently used option. Non-prescription pain relievers such as ibuprofen or naproxen can be effective in relieving menstrual cramps. Just be sure to follow the instructions on the label and consult a healthcare provider if you have any questions. Physical activity, believe it or not, can also be beneficial. Light exercise, such as walking or yoga, can help increase blood flow and decrease the intensity of cramps. It might seem counterintuitive to move when you're in pain, but these gentle activities can actually provide relief. Dietary changes can play a role too. Some people find that reducing their intake of caffeine, sugar, and salt during their period can help minimize cramps. Increasing consumption of fruits, vegetables, and whole grains, as well as staying well hydrated, can also make a positive difference. All these methods are worth trying, but remember, what works best can vary from person to person. Everyone's body is unique, and what brings relief for one individual might not work as well for another. Most importantly, if your period cramps are severe or if they're affecting your daily life, it's crucial to consult with a healthcare provider. They can help determine whether there's an underlying condition causing your pain and guide you towards the most effective treatment options. Remember, it's crucial to consult with a healthcare provider if period cramps are severe or affecting your daily life. Period cramps are a common part of many women's menstrual cycles, and now we understand why they occur. We've delved into the intricacies of the menstrual cycle, the monthly dance of hormones that prepares the body for potential pregnancy. We've learned that period cramps are not just a nuisance, they're a sign that our bodies are hard at work. We've also discovered the role of prostaglandins, the hormones that trigger the uterus to contract and shed its lining, leading to the discomfort and pain we know as period cramps. But we're not helpless against them. By maintaining a healthy lifestyle, using heat therapy, and consulting with healthcare professionals, we can manage the pain and continue to live our lives fully and vibrantly. Thank you for joining us today on the Health Collective. Don't forget to subscribe for more enlightening videos on health and wellness. Stay healthy, stay informed.